Okay, let's get started. I'll start by introducing myself. My name is Rachel Baccarella. I'm with the Human Trafficking Capacity Building Center. The center is a coaching and development hub assisting organizations and tribes with starting, sustaining, or growing their anti-trafficking work. The center sponsors the Ask an Expert series, convening skilled practitioners with registered participants to discuss topics related to human trafficking. You can find other Ask an Expert webinars on the center's website. We are so excited to have you with us here today. Now, I am pleased to turn the time over to Susan Williams. Susan is a nationally recognized victim services expert. During her 24 years with the U.S. Department of Justice, Susan served as a deputy director in the Office for Victims of Crime, enhancing the country's response to all forms of crime victimization and overseeing OVC's human trafficking programs. She has also served as an associate director in the Office on Violence Against Women. Susan, over to you.
Thank you, Rachel. It is a pleasure to be here today and to be part of this Ask an Expert series event. I look forward to this conversation as we explore building a strong human trafficking program. Due to the complex nature of this crime, creating a human trafficking program requires a multi-tiered approach. An approach that includes developing a program's internal organizational structure to better serve survivors of human trafficking and establishing external service networks to more holistically address the needs of survivors. No single agency can provide the complex array of services necessary to respond to victims of human trafficking. Building and maintaining partnerships is critical to addressing the specific needs of all victims of human trafficking. Our discussion today will explore steps for identifying the local need, defining a program's vision, mission, and goals, drafting or enhancing policies and procedures, and developing screening and referral protocols. We also will discuss critical partners and strategies to strengthen an organization's service network. Finally, we will alert you to federal funding opportunities that are available to support your efforts. The Office for Victims of Crime at the U.S. Department of Justice is the largest federal funder of services for human trafficking victims in the United States. OVC is currently accepting grant applications under several of its human trafficking grant programs, and I strongly encourage everyone joining us today to visit the OVC website, as shown in the chat, to see how OVC can assist your anti-trafficking efforts. Now, let's get started with our conversation. Joining me today are our three panelists, Josh Lauer, Lynn Sanchez, and Sue-Lan Chang. Josh is the Senior Program Officer at Covenant House, Alaska, which is located in Anchorage. Through community collaboration, compassionate, sustainable services, and shelter to homeless and at youth risk are provided. Josh oversees Covenant House Alaska's education and employment, outreach, and anti-trafficking teams. Welcome, Josh.
Thank you. Excited to be here, Susan.
Wonderful to have you. Lynn Sanchez is the Director of Human Trafficking Outreach and Aftercare Services at LifeLink, which is located in Santa Fe, New Mexico, and founder of the Sojourners Advocacy Cafe. LifeLink provides client-driven, time-unlimited, rights-based, and trauma-informed care for survivors of human trafficking through multi-jurisdictional and community partnerships. Lynn is also the founder and director of the State of New Mexico's Human Trafficking Hotline, 505 Get Free, and co-chair of the New Mexico Human Trafficking Task Force. Welcome, Lynn. Wonderful to have you here.
Thank you, Susan. Hi, everybody.
Sue-Lan Chang is the program manager of victim services at Mosaic Family Services, which is located in Dallas, Texas. Mosaic Family Services is a safe haven for survivors of human trafficking and family violence, providing trauma-informed and survivor-centered services, including case management, shelter, legal services, counseling, transitional housing, economic empowerment, and community education. Welcome, Sue-Lan.
Thank you, Susan, and hello, everyone. Excited to be here.
All three of these organizations, Covenant House Alaska, Lifelink, and Mosaic Family Services, are also OVC human trafficking grantees. Josh, Lynn, and Sulan, we so appreciate your time today and look forward to this discussion. As a reminder to our audience, please submit your questions in the Q&A function at the bottom of your screen. We will address your questions shortly. However, to get us started, I have a few questions of my own. Josh, let's start off with you. Covenant House Alaska recently started receiving OVC funding to enhance its scope of services for victims of human trafficking. Many of today's participants may be thinking about doing the same thing and expanding their organization's services to include services for survivors of human trafficking. So my question for you is this: what community organizations and businesses should someone meet with when they first consider starting an anti-trafficking program?
Thanks, Susan. So for us, at Covenant House Alaska, we're the largest at-risk youth serving nonprofit in our state, and for a number of years we didn't understand what was happening with human trafficking, with sex and labor trafficking in our city, and we didn't understand that we were one of the places that young people were being recruited out of. And so 15 years ago, our organization learned from a local FBI agent that we were one of the places that folks were being recruited from. And so we got to work on trying to figure this out. So I came to this work 10 years ago, and I knew almost nothing about human trafficking at that point. And 9 years ago, I was considered an expert in our city. So that tells you how many experts we have in this field. So, so for us, we were, in a lot of ways, we were starting from ground zero. And that meant, us learning a few things quickly. And the first thing is that we could not do any of this alone. And so if you're thinking about, as you think about, dipping your toe in this water, just know that you can't do this alone. It's important to find experienced people to learn from, both local and national, and then to understand, to know your city, what services you have, who can help you, and then what you need to work towards. So for us, as we started to think about not being able to do this alone, we needed to first recognize that every unmet need for a trafficking survivor is a reason or a potential opportunity for that survivor to go back to a trafficker, specifically in a sex trafficking situation. So we needed to be able to build, a robust group of service providers and law enforcement around us to be able to meet as many needs as possible. And so for us, we have shelter, we have transitional living, we have rapid rehousing, we have a number of different housing services, but we didn't have a specific anti-trafficking response or a specific response for trafficking survivors. And we were for a number of years, we were serving those young people in our services. But by 2019, we really wanted to be able to jump into this. And so that's when we came and started to apply for federal dollars. But so for folks to know, things to do would be to connect with your local law enforcement. If you have, if some, I know not all federal law enforcement agencies are super friendly. Ours really are. And so I was able to follow around one of our FBI agents doing a bunch of training for quite some time. And then at one point she just turned around and said, "Hey, do you want to do this with me?" And I was like, "Sure." And so find folks that know what they're doing in your area, in your region, locally, or if you need to reach out further. For us, we got in contact with Rachel Lloyd, who runs GEMS out of New York City, Girls Education and Mentoring Services, and she helped us too. So no, you can't do it alone. Find folks to help show you how to do this, and then understand what services you have in your city or in your town, and how you can work together with substance use, mental health, medical, law enforcement, to try to build a team around you. So I also just want to emphasize: do not be afraid to take the leap into this pot of money for federal dollars. because they will help you grow into this. And so no matter how formal or informal you've been responding, they will help you grow up as a provider.
Thank you, Josh, and wonderful advice. Sirlan, I'd like to ask you the next question. As there is no single profile of a trafficking victim, how can a program prepare to meet the needs of all victims of trafficking?
Thanks, Susan. I just really want to emphasize that, trafficking victims and survivors, they're really diverse, even if you're only working with one specific population like domestic minor sex trafficking. At Mosaic, over the last 20 years, we've actually worked with all types of survivors from different labor and sex trafficking settings, from over 50 different countries, including the US. We've worked with adults and minors, all different types of genders, religions, individuals who are LGBTQIA, individuals with disabilities, and all of them come with their own unique background and needs. And what we have found that works best for being able to actually truly connect and work with all types of survivors is it's more than just about receiving cultural competency training. It really requires learning and engaging in cultural humility, which really focuses on self-reflection and growth and being able to step outside of your own perspective and not making assumptions about the victim or the survivor you're working with or what is best for them. I think it's also really important to think about what may prevent victims from different populations from connecting with you or your organization or your services in general. So, for example, at Mosaic, we have found that language is often one of the biggest barriers for some of the most underserved and vulnerable victim populations. For them to even access services in the first place or even know that help exists. Therefore, it's really important for all organizations to have a language access plan. And this is actually something that's often required by federal laws and funding anyway. But at Mosaic, we really made this a priority. And we have a staff that speaks over 25 different languages, and we provide outreach in multiple languages. And I know that might seem like an impossible or daunting task for your organization, but even if you're not able to hire bilingual staff, you can find resources with utilizing paid interpreters or translators, or building your own group of volunteer interpreters, or partnering with language and culturally specific organizations. And I think the other last thing I'll just maybe add is, as you're screening and identifying potential trafficking victims, it's really important to kind of develop a response protocol that takes in considerations the diverse needs of victims and survivors. And I would just like to echo what you and Josh have already said about the importance of building partnerships, because despite our best intentions, no one organization can truly meet the needs of all trafficking survivors alone. It's really important to know your community population, know your own limits, determine what you can do in-house versus what you need to refer out. And it's really important to do the community mapping and identify those community partners to connect victims and survivors to the most appropriate organization to address their unique needs. And especially looking at identifying trafficking specific organizations or community partners that are specifically working with those underserved populations that have additional challenges and barriers. And just also not reinventing the wheel, just because don't reinvent the wheel. Build off of your existing infrastructure and the existing resources and efforts that are already existing within your own organization or in your community.
Wonderful. Thank you, Sirlan. And I would actually add to that, build off of the resources that are available around the country, because there are a number of resources. So if your community is really brand new to this, there are plenty of places you can go outside of your community to get resources to get you started. Thank you very much. Lynn, well, first of all, I want to make a quick reminder to the audience to please continue to submit your questions in the Q&A feature. We will get to these questions very soon, but first I have one question that I'd like to ask to Lynn. So Lynn, here's my question for you. How is victim-centered trauma-informed care used in anti-trafficking work?
Hi, thank you, Susan. So I would just say that, follow the principles of trauma-informed care, which you can find on SAMHSA site. I think that's in the chat. But really just kind of, for me, if I just look around the agency and I think, would I want to come here if I was in a traumatic situation? Would I feel comfortable and safe here? And I mean, not all agencies have the opportunity to have an outreach center like we do. Ours is set up like a coffee house. So people can come in right off the street, and that never happens with trafficking victims, as everybody here knows. Like, they're not just going to walk in a facility and ask for help, probably. But who's at the front desk? Who's going to be the first person to talk to them? What kind of paperwork are you going to give them? Are you going to have them inundated with like a 20-page intake packet? In terms of working with them directly, we don't need to know the details of what happened to them in the crime of human trafficking. We're working with them on issues like trauma and homelessness and substance abuse. So we want to be really sensitive to opening up their traumatic memories and experiences, and just be really careful with the kind of questions. I do mental health intakes for survivors, and I don't need to get into the details of how they were traumatized by the crime of trafficking. I'm looking at them as a survivor, and what do they need going forward, and what are the services that they're going to need around them. And I just think, being trauma informed is about thinking about the individual and having your services meet their needs, not our expectations of what their needs are going to be. And you're only going to get to that through conversation with them, and the process of just, doing a needs assessment. And I think that's, a really beginning point, a really great starting point for being trauma informed, is putting the client first and giving them voice and listening to them and giving them an opportunity to have that voice too. Because, a lot of the times through our processes, we don't stop long enough to really, listen to what clients are telling us. We've had housing programs that are, HUD funded or whatever. And, there's a lot of steps that people have to go through to qualify for those types of housing programs. So when we got our transitional housing money through VOCA and VAWA, we made sure that it was barrier free, like very few hoops and hurdles to go through. Like, if we can find a landlord that's going to rent to you, we're going to, you're going to get that apartment. And so, that is, I think, removing barriers is a big piece of trauma-informed care. A lot of agencies have things like protocols in place, like no-show fees. It might just be a nominal $5 fee, but $5 for somebody who has no money is a lot of money. A lot of housing programs have requirements that you have to pay a certain percentage of your income once you start working, and that could just be getting a disability or GA, which is only $250 a month or something like that. Well, to pay $50 of that is traumatic. And so we want to remove all of those policies and, practices that, maybe were set up by the federal government even or whatever, but there are ways to work around that. And I think that that's really important to just kind of get an idea of all the different ways that our systems traumatize our clients.
Thank you, Lynn. Thank you very much. And I think this is really a wonderful kind of start to our conversation. And at this point, we're going to start taking some questions from the audience. And I, again, want to encourage people to continue to send your questions in. I see that they are coming in the Q&A, which is exciting. The first question that has come in, I want to pose to Sulan. And Sulan, this question is: a domestic violence service provider organization recently added a housing program for victims of human trafficking. Are there effective screening questions that can be added to our intake that could help us identify victims of human trafficking earlier than during their counseling sessions? Your thoughts?
Yes. And I would say, Mosaic, we actually started working with refugees and domestic violence victim services first. So we're in a very familiar place. I believe that there is actually going to be resources shared for OBC webinars that specifically cover about screening best practices and screening tools and questions that can be included in any step of your protocols. So I just wanted to mention a few things to think about when you are thinking about adding screening questions. And that is that it makes the answer to this hard because not one size fits all. you really have to think through the screening tools and questions and the population you're working with, the purpose and goals for screening, and keeping in mind that some of the screening tools that are being offered, they're designed for specific populations and not all survivors. Like some are only designed for, homeless population, or for sex trafficking, or for youth, or for adults only. And so it is really important to keep those things in mind as you're trying to decide which screening tools that you're going to use. The best practice is to use a screening tool that has been validated. Although there are other tools out there that are not, they're both tools that are validated and not validated, and both of those I think will be shared. I will add that it's really important to screen for both labor and sex trafficking. I think most of the focus on human trafficking tends to be focused on sex trafficking, which is really important, but we want to keep in mind that there are just as many, if not more, labor trafficking survivors out there or existing. And if we're not screening and identifying those individuals, we're missing the opportunity to engage and provide services and provide holistic services to address all of the different victimizations and needs. And then the last thing I would just say about thinking about screening is just making sure whoever does the screening does have the appropriate training and understanding of the dynamics of human trafficking and elements of force, fraud, and coercion. And when you're in doubt, always reach out for consultation or refer to a trafficking specific organization or a national or local human trafficking hotline. So.
Thank you, Sulan. Our next question I would like to pose to Lynn, particularly because of your work as part of a human trafficking task force and your work with law enforcement. So this question, need some glasses. This question says, I would like to hear about any work with system or law enforcement-based advocates and how you balance roles and duties. Your thoughts on that, Lynn?
Yeah, I think it's just, get a feel for who's, which law enforcement agencies are doing more human trafficking work in our state. It's either the Attorney General's office or Homeland Security. We work with some vice units around the state. Oh, well, we only have one actually. It's two small vice units. There are only like 3 or 4 people on those units. So we're a huge state with a very small amount of resources. So, and then just kind of, it's just developing the relationships as you go. You start talking to them, you tell them what you're trying to do. You want to help survivors. They're trying to build cases, and so they need somebody to refer the survivors to so they can have a case. But I think you have to expect that there's going to be some conflict, and hopefully it's healthy conflict that's going to create growth. But there's going to be a little bit of tension because the law enforcement want their person to be housed and off the street and ready to testify or whatever. And you're dealing with all the, providers are dealing with all of the struggles and challenges around stabilization and mental health and substance use and, housing resources and things like that. So, but I think, it's been around 10, 12 years now that our state's been working together, and it just takes time. You have to be patient with each other and willing just to, we're still talking to each other. So I think that's a great thing. And so, just identifying law enforcement that are doing cases and having them know that you're out there and ready to provide services to victims.
Yeah, that's great advice, Lynn. And kind of thinking about OVC's programs, there is a program specifically geared towards supporting that collaboration and through working with law enforcement and others through Human Trafficking Task Force. So something very interesting for many on the call to take a look at. The next question I'm going to pose, Josh, I'd like to address this question to you. I know certainly your work and your organization's work particularly works with youth. And so I'm going to start this question with you, and then if others might have something to add, we can certainly take that next step. So the question is, our program is working with minor girls in the custody of social services. We are not requiring the girls to participate in therapy, but rather trauma education and training in the hopes that they will decide to participate on their own. Would this be a barrier in obtaining a first-time grant? Actually, Josh, if you want to answer that question, that's wonderful. And now that I've seen the whole question, I have a follow-up to that. But go ahead if you will, Josh.
Sure. Well, so from my perspective, I don't see that as a barrier. And I think one of the things that Lynn had said that's important is that, especially like, the HUD might have rules, OVC might have things. Everybody has. There's a lot of rules, but we have opportunity to create systems and programs that help young people or help survivors, whatever level that is. And that means we can have the same way we have conversations with law enforcement or with other partners. We have conversations with our funders, and we say what we need, and we say, this is what we're trying to accomplish here. And we have found that, that folks will work with us around what programs we're delivering, and really just on the other side want us to be really good at serving, survivors of trafficking. And so, maybe you have more thoughts on that, Susan, but I don't think that's a barrier.
No, actually, I think you've covered it well. Thank you, Josh. Unless anyone else has something to add.
Yeah, I think maybe one thing I'll just add is a lot of times when we think about requirements for services, obviously we're going to advocate from a model of, and OVC also advocates like voluntary services, not making anything, not making services a require or condition for receiving, OVC advocates for like a voluntary services model, which means like you're not requiring any particular service or particular, participation in order to access services. However, I think a lot of times sometimes it's about the perspective. Sometimes people are looking at what they're trying to require victims to participate in versus looking at trying to understand what might be the barriers or challenges for participation, trying to understand the underlying reason why somebody is not engaging as much as you would like in the program. It could be a number of different factors of just needing to be stabilized or needing to just have time to heal, time to get stabilized, time to feel comfortable. It could also be looking at maybe the services that are being offered are not actually matching what the survivor needs. So it might be, as a program, we need to kind of rethink the services we're offering and what we're asking people to participate in. So just kind of trying to take the perspective of rather looking at whether somebody's required to engage or not, what might be barriers to engaging and why they may not be engaging in the first place.
If I could piggyback off that really quick, because we work with a lot of referrals that come from children, youth, and families. It's, young teens who have aged out of foster care, or they're just getting out of a residential treatment program, and there's nowhere for them to go. And really, we don't require them to do anything. Just meet with us once a week and let us, make sure you have the food that you need and that you're safe in your apartment. And usually within, 30 to 90 days, we know that that's when trauma starts to subside enough that you can start working on longer term goals. So it's like Sulin said, it's just like sometimes they don't need any services. There's not time yet. Just let them have, the safety that they need first, and then, they'll tell you what they need.
I also just wanted to comment from a grant management standpoint, like especially as for us, we've been an agency for a lot of years. We've just in the last few years had a specific trafficking response, but we've learned a lot in the first year. And some stuff worked and some stuff didn't. And some partners we thought were going to come through didn't come through. And, and so we were able to go back to the narrative, go back to the folks at OVC and say, hey, this worked, this didn't work. We're what do you think about us changing this? And so I think sometimes there's sort of a fear of getting locked into a way of doing something when you go after, federal dollars, but it really does not have to be that way. It's only that way if you make it that way. So really, I think, again, or at least my sense around funders, period, is they want you to succeed. And so, go get it.
Absolutely true. Absolutely true. Wonderful points. And I'd actually like to bring this next question back to you, Josh, as somebody who a few years ago did stick your toe in the water, and as your organization kind of was taking on this new area of service delivery. So this question comes from somebody who recently started a new position as an adult advocate, but they found that getting the word out about their job has been difficult. And so, what advice might you have for getting out the word about the new services and that a new service provider has to offer, and how to get the word out in their community?
Well, so, for me, I started my career as an outreach worker. And so my whole job was to go around our city and build relationships with young people. And that really translated for me as I've switched roles is, Lynn said this too, it's relationship. It's not different than what we do with our young people. We're going around building relationship, find ways to engage with people, knock on doors, make phone calls, in COVID times, I guess. But being able to build relationships, and one of the things, in thinking about sort of mapping and understanding your context, find out who the big players are and go make friends with them. Because if you get into certain doors and you make certain relationships, that will open up other doors for you. But I do think, and I don't know where you sit in your organization, and I don't know if you have other resources or other people, but it also, there is, the more that your organization is able to do that with you versus one person, that also is a big deal. So being able to really have your organization do that with you, so you're not just one person trying to make that happen.
Great.
I'd like to just add one thing to what Josh was talking about. I think if you build it, they're going to come. So there's such a shortage for services. We get referrals from all over the country, and even actually outside the country. So there's such a need to help survivors. So please don't even worry about how you're going to get your name out there, because it's going to happen.
Very, 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 very true. I'm sorry. Go ahead, Sulan.
Oh, I was just going to add, this is where talking about building upon that existing infrastructure. So like looking at coalitions and networking opportunities that already exist, either locally or nationally, and looking at related victim services like crime victims, coalitions, or domestic, so building upon those kind of coalitions and getting your name out that way. And I'm just going to echo what Josh really said about building those relationships between organizations rather than necessarily individual advocates, because as we all know, staff come and go. And if your entire relationship is relying on one person, that's really tough when that person leaves.
Very, very good point. I just want to remind our audience that after we are done today, we are going to be providing follow-up documentation that's going to summarize the discussion that we had today, and also provide a recorded copy of this program. So you'll have all of this that you look at after this date as well. My next question, I'd like to pose it to Sulan. However, again, I think for all of you as service providers, you might have some thoughts on this. And the question is there a model of case management that you recommend?
I think that's tough. And I look to my partners if they have something more specific. We don't utilize a very specific model by name. I think what we have tried really hard is to develop case management services building upon different types of approaches and taking into consideration like trauma-informed care, taking in consideration strength and empowerment models, taking in consideration like a human rights-based approach. So I apologize. I don't have this is the model you got to go to. I think oftentimes, again, you have to look at the populations you're working with and kind of customize. So my suggestion would be to try to get as much training and knowledge as possible about different types of approaches and methods in working with survivors, and kind of customizing and creating a model that works for your particular population or community that you're working with.
Also, Seeking Safety is evidence-based, and it's a really great guide they have a section in that it was developed at Harvard, and it's really designed for groups, but it actually has been shown to work better one-on-one. So it's the case management piece, there's a lot of empowerment pieces in there, coping mechanisms, substance abuse, trauma, asking for help, personal safety. We just love Seeking Safety. As a matter of fact, we train our team periodically in it. So And like I said, it's evidence-based. So it's a really good starting point for sure, and a good guide.
Yes, so there's a couple of questions that focus on screening, and I'm going to try to combine them. And again, I have a feeling since all of you are providing, services to specific populations, you might have some thoughts on this. But one of them is focused on screening in residential care facilities. The questioner basically said, I work in a residential care facility with human trafficking adolescent survivors, and we have struggled with how to help youth buy into treatment options in the beginning. This has resulted in frequent runaway behaviors within the first week of placement before the youth is able to form meaningful connections in treatment. Any ideas or thoughts on how to help decrease this unsafe behavior at the beginning of the process?
Well, I can speak to that. I mean, we run a shelter with minors, and I don't know what your specific process is, but I know for us, and I think Lynn and Sulan have both spoken to this already, that the less that we try to force young people to do from the beginning, the better. And so the more opportunity that you have to focus on relationship and meeting basic needs, which helps build relationship, I think the better you have. So for us, we overhauled our entire intake process. We actually call it arrival now. We got rid of the intake language because we didn't like it. And so our arrival process, for us, even with minors, we don't really expect anything from anybody for at least 30 days, because we've looked at the brain science, and we know that a young person in crisis, like physically cannot leave their amygdala and get into their prefrontal cortex to have forward thought until they're stable for at least 30 days. And so if there's any way for you to slow down any of those processes to focus on relationship, and get to treatment when you get to treatment, or get to therapy when you get to therapy, that's what I would work toward.
Any other thoughts? Okay.
I think maybe another thing I would maybe add for the youth population, in addition to what Josh already said, is maybe finding a way to just have consistent access or follow-up. So maybe a residential center is not going to be we do see survivors, and this is not just with youth, but also with adults that come and go. So being able to provide consistent way for survivors to engage when they're ready to engage, whether that's a drop-in center, whether it's just a hotline, an advocate they can always go back to, or even, like I think Linda had mentioned, low barrier services. Some of our education programs and services are the easiest, low access. They don't, really even need to do intake, like that kind of, and they can come and go as they please. So thinking about ways that you can engage in a consistent way that doesn't require long-term staying at a program.
Thank you. The next question that I'm going to pose, actually, I want to put it out to the group, because this might be something that any one of your organizations might have had experience with. So has anyone been able to leverage federal funding with private funding for sustaining local efforts? And if so, what were the keys to making this happen? Has anybody here had that experience, or do you know if your organization has? And that actually might not be as common. So I wouldn't be.
For us, we are 75% of our, and this is, I'm talking about our whole organization, not just our trafficking response, but 75% of our dollars that come in are non-grant based dollars. And so a lot of that is fundraising, and we have a large fundraising team. And so I would say that we have leveraged those dollars into federal dollars. But I don't have experience going the other way from federal into, other types of things.
Yeah. Okay. Thank you. Another question, again, tied to screening screening and tools, but it also reflects on the realities of COVID. And so or at least touches on that. In this question, I would like to pose to Sue Lan, although of course others may have some thoughts, of have any screening tools, recommendations, or other material provided by OVC seen any significant revision because of the pandemic? And of course, you're all grantees, so you might each have an answer to this, but that's a good question because there's, a lot of service providers have certainly modified their services during the past year and a half. And certainly there's been a lot of conversations about that in terms of what's working, what to hold on to. But I'm curious from your perspective as grantees, if you have also noticed any significant changes or revisions and recommendations that you've gotten.
I would say I don't think I've seen any formal revisions of any tools or screening tools, especially those that have already been validated. But what I will say is what I think has changed is the format or the method in which we conduct screening. Just because with COVID, everybody's had to switch over to much more digital services. You're doing more by text, phone, email, different types of communication channels. And so I think the key here to me is a lot of flexibility, just being able to not have the same expectation for every single screening, intake, assessment, and finding that a lot of times, especially if you're doing stuff by video, things get interrupted. You're not going to be able to engage in services, the intake with somebody or a meeting with somebody the same way. They might be interrupted by children. And so it's not so much that the screening tools or process has changed. To us, it's been more that we've had to adjust how we offer those in the first place, and then being able to be flexible and accommodating and knowing that things will take much longer. Like it'll take longer to probably screen somebody. It'll take longer to have those conversations, and that it may not all happen in one setting or one appointment.
Thank you. This next question I would like to send to you, Lynn. The question is, does anyone have a curriculum they could share or direct me to for a support group for survivors? I'm an advocate, not a therapist. There are no support groups currently in my county.
We've thought about that, and we've looked for support groups in New Mexico for survivors of human trafficking. And we've even tried to, do our own groups with therapists and stuff that can, do more than one person together. And it seems like it's really difficult. I think it would depend on the level of the survivors, recovery or mental health. And what we found is that a lot of people report being triggered by each other, and we just haven't been able to figure that one out. So I guess I shouldn't have even tried to tackle that question. It's a complex one, though, and it's something that everybody's kind of looking for. Where do human trafficking survivors go for support in terms of having their own group? And, we don't have anything like that in New Mexico. I know that for sure.
Thank you. Any other thoughts on that? Usually this might be an area for the center to follow up on. Really good. Switching gears a little bit, Sue Lan, I think you touched on this a little bit in terms of providing services that are culturally competent. Josh, I know that this is work that all of you are doing, and to ensure that services are really tailored to the needs of the survivor, and that includes being culturally competent, culturally relevant. But the question, and I kind of want to toss this out both to Josh and Sue Lan, is that how do you incorporate culturally competent services in Native communities? Josh, I would certainly imagine that this is something that your organization will work with regularly.
Totally. Yeah, no, 52% of the young people that we serve are Alaska Native. And so I think when First of all, it's a little bit different, I think, for us here in Alaska because colonization happened a little bit later, and so like we still have elders who were taken from their homes and beaten for speaking their languages, and so colonization is fresh here, and the federal government took a little different route, so there wasn't. We don't have reservations up here. We have Alaska Native tribal organizations and corporations. And so one, I think wherever you are in the country, you need to understand what happened to Native people in your area, what happened to them, where they're at, how they're surviving or thriving, or what happened. So understand that at first, and then I think for us it has meant partnering with multiple of these organizations to teach us, as well as hiring a diverse array of staff many of whom are Alaska Native, and so we have we have cultural events, we have cuss book making and bead making and drumming and dancing, and we smoke salmon in the summer, and we do a bunch of cultural events, but then we also have to think about our spaces. So we're a small city, but we're 350,000 people, and that's half the population of the state of Alaska. And the majority of our young Alaska Native folks who we serve are from rural areas. And so understanding the dynamics of not just the Alaska Native culture, but the challenges of being, rural to urban. And so we have a big space that young people gather, and that can be really overwhelming for our young people who are coming from rural areas because, it's just a lot of noise and it's a lot of people, and understanding, rhythms of time and speech, and, and maybe we're going to make eye contact and maybe we're not. And, really, really looking to understand holistically, who the Native folks are that you are serving, and then inviting them, to be a part of the process, I think.
Thank you. I do want to move on to another question because I know we're running out of time and we have a few more questions. If we don't get to all the questions, again, we will be providing some follow-up. So we will answer all in the end. But this question I want to pose to Lynn, particularly because of your work with task forces and what this means with information sharing. And the question is, what are some of the best practices when sharing case information with other advocates or service providers? How can we collaborate and ask for support, but it'll also protect and respect people's privacy? Incredibly important question, particularly when we're talking about collaboration. Your thoughts, Lynn?
Yeah, and please help me out.
Okay.
Sulan and Josh, because this is very complicated. So, survivors sometimes may show up at my organization and they'll be there for a couple months and leave and go to another organization or even another state and then come back. I mean, they're not, when you would bring someone into your program, it doesn't mean they're going to stay there until they're fully recovered and never need services again. So we follow HIPAA guidelines, and for coordination of care and safety, it's okay for me to reach out to another organization and share some type of information that will coordinate care for that survivor, but I can't divulge, information without their permission, other information, but I can do the very minimal. The same thing when working with hospitals or psychiatric units or even law enforcement. And so it is really, it's a very sensitive and complex, issue when it comes to sharing information and trying to collaborate around a survivor victim that, all the different disciplines are probably working with.
Mm-hmm.
I don't know.
I echo that sentiment also. I will say one thing that we were able to get done, and this is more from the data collection side, but we use a system called Efforts to Outcomes. I don't know if folks are aware of that system or not, but we were able to be a backstop for data for a bunch of different organizations who could put in anonymously the data. So we could also include DV providers and other folks. So we knew that there was going to be some duplication in that because we are, working with some of the same folks. but we were able to sort of aggregate some data to be able to really understand more of the issue that way. And we offered to house that for our city. But I mean, so much of one of the big issues that we have as providers is people say, well, what are the numbers? And that's a big challenge I think for everybody across the country to say, how do we get the data on this? And so that was a creative solution that we were able to put together. But so there's ways, just like all these other things, we're creating on the go. We're trying to figure out what works. And but
well, and I will say, go ahead, Solan.
Well, I guess I just wanted to kind of add to this because we keep emphasizing so much the importance of community collaboration. And I think part of that is going to result in issues between organizations working together, different privacy, confidentiality, like we follow HIPAA, we follow VAWA confidentiality. And that does sometimes lead to barriers with working with other providers who have different expectations. So I think my best advice is to try to have those conversations up front and as much of a formal and written process. Don't let the first time you're saying no to providing information be that be the first time you're engaging with that other community provider. So even trying to do something like a one-page written handout that you can give to different community providers or people that you're going to regularly work with that explains the general provisions of confidentiality, what you can and cannot do, or what your general process, and just explain how it's not a barrier and that there might be processes you just need to go through before you can provide information that they're asking for.
Absolutely. And I think, again, this is kind of a wonderful note to end on. Unfortunately, we've actually, our hour is up, but we started talking about partnerships and we're ending talking about partnerships. And I think that's so vital to this work. And you're right, the idea about collaboration, it requires very strategic conversations about information sharing and privacy and confidentiality. That's just something that really has to be a part of this effort. We are at time. And again, I want to remind the audience that we are going to be following up with some written responses to questions. We apologize we couldn't get to all of the questions, but thank you so much for providing your questions today. And thank you to our panelists for sharing your thoughts with us today. I think this has been a really exciting conversation for our audience. I hope that our panelists have offered you some new insight for building human trafficking programs and that you're energized to dive in a little bit more. This conversation is incredibly timely as OVC is currently accepting grant applications under several of its human trafficking grant programs. Grant application deadlines will vary by program solicitation. However, most grant applications this year are not due until late June or early July, so there's still time. So I encourage everyone to go to OVC's website and take a look at the programs that are there, review the funding solicitations carefully, and apply those grant programs and apply for the grant programs that will best support your organization's anti-trafficking efforts. If you have questions about how to apply, or if you need assistance with your organization's work, the Human Trafficking Capacity Building Center offers a variety of no-cost services and help to organizations and tribes who are interested in starting, sustaining, or growing their human trafficking services. The center's free coaching services include open office hours with topical experts, one-on-one coaching, and cohort sessions. So please visit the center's website to learn more. And finally, once again, I just want to say a huge thank you to Josh, to Lynn, and to Solan for giving us your time today and sharing your expertise with us. Thank you so much. And with that, I'm going to turn it back to Rachel.
Thank you, Susan, our panelists and participants for this great conversation today. We will be following up with each of you through email, attaching relevant resources, a Q&A summary document, and a recording of this discussion. Please join us for our upcoming Talking Circle webinar on June 16th at 3 p.m. Eastern. This is a sister series to the Ask an Expert webinar and is for tribes and tribal organizations. The topic for next month is how to start, sustain, or grow tribal victim services with federal funding. And before we close today, please take a moment to respond to the poll. The link to subscribe to OVC News is in the chat. We encourage you to subscribe so you'll receive notices about OVC programs, initiatives, and funding opportunities. There are also links to the Understanding Human Trafficking training series and a list of OVC-funded grantees and human trafficking task forces listed in the chat. We hope you will use these resources in your work and that you found today's session informative. We look forward to having you join a future Ask an Expert webinar. Thank you again and have a great day, everyone.